So Wellness Center has always been part of my dream because when I worked in my tertiary care center where I was trained in Boston, we had separate wards for every ailment. We had a GI ward, we had a cardiovascular ward, we had a hematology ward. So it was as if the whole body was disjointed and everything needed to be looked at through like a microscope at one particular organ. When I started practicing, I realized that everything's actually connected. And now, with more and more research coming out that shows how the gut and the microbiome, which is the good bacteria in the gut, gives us genes that affect everything in our body. It really, as I learned more about how the body worked, I realized that I just need more time to spend with patients in terms of finding out what's going on in their bodies and how they're breaking down. So the reason I opened the Wellness Center is to give me more time with the patients. So our first appointments are typically 90 minutes. So that gives me enough time to kind of collect data, to go over the things that have been looked at already and the things that haven't been looked at, and to find new treatments for patients that haven't been tried before. But the biggest thing is also explain why those treatments might benefit them. Oftentimes in a regular traditional practice, we're giving out advice, but we don't have time to explain to the patient why or educate them on why and how this would help them. So now we have a staff that's also able to spend time with them. I have more time to spend with them to try to explain to them. We have classes here that educate patients. I give lectures and talks at the practice as well to kind of tie in the whole system of how stress and the gut health link everything to one another, because oftentimes patients have never heard of the things that we're talking about because other doctors frankly don't have time because of the very fast pace that traditional practices run at.